The time when I was working with people who were perhaps being given labels by others as most complex and or had lots of needs and stuff, you go and meet them, and one of the first things stopping them actually achieving anything was the fact that they would have anywhere between 6 to 10 or 12 appointments in a week with 6 to 12 different people, and they spend nearly the same amount of time as you're describing, but going round in the end to achieve 10 different 45-minute conversations rather than getting the benefit of 500, 700, 1,000 minutes worth of one conversation that could actually develop into something meaningful, of course. Yes,
exactly, and go so deep. So that had been the previous structure, is there'd be a scattergun referral approach, and people get tied up in all of those, and then their ability to be a better parent was judged on whether they turned up to any one of those things.
Yes.
So, it was so challenging for people working with a mum who was self-medicating really for her mental health problem, but had 2 children, one with special needs. They had to go to different schools, and it was being demanded of her that she turn up at 10 o'clock in the morning and 4 o'clock in the afternoon to pick up the drugs she'd need from the clinic that would prevent her self-medicating. Well, those 2 times with 2 children in different parts of Cardiff in school, it's not possible. Mm. But the people who were on the receiving end are saying she missed her appointment again, and it was
perceived. Back to what we said earlier, would even then ascribe the label of unmotivated, doesn't want to change.
She loved her kids. Loved her kids, felt so much for them. Yeah. So we in option 2 was able to shift that really quickly, and she moved to a very strong place. So you have to start where people are, not assume that services define motivation. You have to start where people are, and that this 4 weeks enabled you to truly do that. The trust that builds between one worker and one family is unprecedented, and that trust provides total disclosure. So within a week, you know everything. Mm. And when that deep disclosure comes, there was masses of supervision back in our team, shared reflective practice where we taught that through. And the question for all of us would be, does that disclosure indicate a new issue that we have to rethink, or can that be wrapped up in the intervention? Let's not knee-jerk here. But then we had to consult with all the other professionals around the family to help them understand that this is still conditionally safe. So there was a lot of the evidence that the system was the problem, not the workers within the system and not the families within the system, but the system itself was the problem.